Hello, everyone. My name is Gabriel Smith, Program Associate for the Center for Economic Well-Being at the National Council on Aging. I'm joined today by the Assistant Director of Health Coverage and Benefits, Ryan Ramsey. And this is the second video in a two-part series focusing on the Medicare Plan Finder tool. When people consider enrolling in Medicare Advantage plans or prescription drug plans, one of the major tools that is out there is the Medicare Plan Finder tool, which is found on Medicare.gov. This tool allows people to compare the plans available in their zip code, including being able to enter prescription drug information to get a rough idea of what their costs will be for the year. Now, Ryan is going to walk us through how to use the Medicare Plan Finder tool, this one specifically for Medicare Advantage plans, with the help of an example. Ryan, once again, thank you for being here, and I will pass it off to you.
All right. Thank you, Gabe. And yes, we would love to take everybody through how to use the Medicare Plan Finder, how to collect that information from people, and how to read the results of what comes out of the Medicare Plan Finder. And Gabe has very graciously agreed to play our test beneficiary in the scenario. So I will point out to everybody that where you'll find the Medicare Plan Finder is on Medicare.gov. When you navigate to this website, this will be the home screen that you see. You'll see a lot of information about how to get started with Medicare. And of course, right now, because we're in the annual enrollment period, which spans from October the 15th through December the 7th, you'll also see some information about how to find plans for the annual enrollment period. Regardless of what point it is throughout the year as well, you will also be able to find those plan enrollment links right here up at the top right. If you click on health and drug plans, you'll notice the column here that says find and compare. You'll see find health and drug plans right there, and you'll be able to navigate to the same location as where that it's open enrollment now to December the 7th find plans link would take you to. Now right here we've stumbled onto the Medicare Plan Finder. This is where we start. You'll see right now, like we pointed out, it's time to pick our plans for 2026 from October the 15th to December the 7th for the annual enrollment period. It gives you two options of how we want to complete the initial information for our Plan Finder comparison. First and foremost, we can log in. If you have a Medicare.gov account, it will have all of your information, your list of saved drugs from this current year, all locked in there. If you do not have that account, you can certainly create one. I will let everybody know that as of September of 2025, you're now required to provide an email address when creating your Medicare.gov account for multi-factor authentication purposes. Anyone who has already created one was grandfathered in. However, if you're creating a new one, as of now, you do need to have an email address to be able to create that. So unfortunately, if you do not have an email address, you would not be able to create one at this time. Luckily, that brings us to the second option here, which is a generic search. And it's what we're going to do today for the purposes of our test beneficiary. So we're going to also just make sure that we're looking for coverage for 2026. It does give us the option to look at this year's coverage if you are interested in looking at that. However, because we're doing a comparison for the following year during the annual enrollment period, we're going to be looking at 2026. Now, Gabe, what is the zip code for Mr. John Doe?
It's 10001.
1001. Okay. And I believe earlier that you said Mr. John Doe was looking for a Medicare Advantage plan today.
Yes, that is correct.
All right. So you'll see right here that we can select the type of plan like Gabe and I just discussed. Mr. John Doe here is looking for a Medicare Advantage plan, so we're going to want to select that. Just for a really quick aside for everybody, Medicare Advantage is the option that is aside from original Medicare. So Medicare Advantage, also sometimes referred to as Part C or health plans with drug coverage, take the place of original Medicare and provide us with our Part A hospital, Part B medical, and Part D prescription plans, all combined under one plan. So we're going to select Find Plans and move forward. It's going to give us the option to also include any help that we may receive towards our Medicare health or drug costs, whether that be Medicaid and you're a dual eligible beneficiary, whether that is supplemental security income, a Medicare savings program that helps with your Part A and B premiums and copays and deductibles, or extra help that helps with drug costs. Now, does Mr. John Doe receive any assistance, Gabe?
No, he does not.
No, I do not get any help from any of these programs. So we're going to continue on right here. Y'all will excuse me. I'm going to remove these list of drugs from previous comparisons, and we're going to see that this is how it should look when we navigate here cleanly, is that we're going to want to add a drug, and it's going to ask us, do you want to add drug cost in with this comparison? You're going to want to say yes. Yes, I do. And add a drug. Now, what is the first drug that Mr. John Doe takes?
Lisinopril or lisinopril?
Yep, lisinopril. Perfect. And what is his dosage?
30.
30. He's taking 30 milligrams. All right, perfect. And what is his quantity that he is getting per month?
It is 20 milligrams. Apologies.
Oh, no, that's perfectly fine. And his quantity that he's receiving?
30.
30. Okay, perfect. And is he taking that once a day?
Yes, daily.
Yeah, perfect. So you'll see right there, 20 milligrams. He's receiving 30. And that means, and I did check with Gabe that he's taking one a day. So that means that he's receiving those on a monthly basis. We're going to move forward. What is his second drug?
Metformin.
Metformin. Okay. And you will notice here that with metformin that you'll see metformin, with a lot of other medications listed here. However, if they do not have any, sort of additional information around that metformin, you're going to scroll down and you're going to locate that metformin hydrochloride and select add drug. Now, what is his dosage on this?
500 milligrams.
500 milligrams. Perfect. And what is his quantity?
Yep, 60. Yep.
60. And is he taking that twice daily?
He is.
Awesome. So that means that he's getting that filled every month there. You can absolutely tell people that, offer them if they say, yes, I prefer to get this on a 90-day supply. You can enter that information, but he's taking 2 of those per day. So that keeps that simple for us. What is his third medication?
Glipizide?
And if you want to spell that, that's perfectly okay.
Glipizide.
All right. And what is his dosage?
5 milligrams.
5 milligrams. Perfect. And his quantity?
30.
30. So this automatically came with a 90. So that was 3 a day. So he's actually only taking 1 a day. So we're going to lower this down to 30. And he's taking that daily. So we're going to add that to his medications. And his fourth one?
Atorvastatin. Vatistin. Sorry. Atorvastatin.
Yeah, the Torvastatin. And that is something that 100% is a point to point out too, is that, I have heard people call medications by a lot of different names. In any time where you feel like that you don't know what that medication is, don't be ashamed to ask somebody, hey, can you spell that for me? Definitely, I've done it a lot during my career. And fortunately, Gabe is giving me a lot of medications that I know very well. So I get to show off my pronunciation skills on the recording. What is the dosage that he takes?
40 milligrams.
40 milligrams. Perfect. And his quantity?
30.
And is he taking that daily?
He is, yes.
Awesome. And what is his fifth medication?
All right. It's Naproxen.
Proxen here. And his dosage?
250 milligrams.
All right, 250. And his quantity?
30.
30. And how often does he take that?
It's listed as needed.
All right. This is a great thing, and I appreciate Gabe bringing this to Mr. John Doe's case here, is that he takes that as needed. So this would be a great opportunity to ask this person, well, how often are you getting this filled, or how often do you typically take that? And you may hear that somebody is taking that daily, or they may say, well, I get flare-ups. This is a arthritis medication, so really, when my arthritis flares up really badly, I'll take it. So maybe I get this filled, every other month or once a quarter or anything like that. But sometimes I have to take it a lot, and sometimes I get it filled monthly. Just for the purposes of our demonstration, let's assume that person said that exact thing. Sometimes I get it filled about every other month, but sometimes my arthritis gets really bad and I have to take that monthly. If I'm doing a comparison for them, I want to compare for the scenario that would be the highest costing for them. So in the scenario that they said, well, sometimes I get it filled on a monthly basis, I want to leave that as a monthly basis, because when I give them the comparison of what the total cost for the year is, if they say do not have to get this filled once a month, then their cost is just going to be lower than the estimate or than the total that I give them on this comparison. Whereas opposed to if I put this every quarter and they ended up having to actually get that filled once a month next year because their arthritis was particularly bad, it would actually be their total for the year would actually be more than what I'm comparing them right now. And therefore, it could look like the information that I gave them was not as accurate as what it should be, because there was a fluctuation in their medication. So for the purposes of this demonstration, we're going to put that as that he gets this filled every month to make sure that we're covering him and giving him the most accurate comparison possible. Now, does he take any other medications, Gabe?
That was the last of them.
All right. So then once we've entered all of those, we're going to go to done adding drugs. But I want to give everybody just a really quick demonstration really quickly here. We entered in all generic medications here. But if I was to go in and select a brand name medication, Xanax, in this scenario, and click add, it would notify me that drug actually has a generic. So in that case where, if this gentleman had said, I take Xanax and I entered that in, I would be able to say, okay, do you actually take the brand name Xanax or do you take the generic, which is alprazolam? If he says, no, I do take the brand name, then obviously we could select key brand. If he said, no, I take the generic, I would add the generic. And of course, if he said, yep, I take the brand name, then you could go in, ask the same level of questions as before. However, if I was to come right here and put alprazolam, which was the generic for Xanax, when I enter that, it doesn't give me the other way where it says this drug has a brand name option. Now, that's not something that I would tell everybody that you have to be necessarily super worried about. Typically, when someone is giving you their list of medications, they're giving you the name of the drug that they actually take. So if they're giving you the name of a drug and you don't recognize that name, it's probably because that's a generic medication. They're not as likely to give you the generic version of a drug and then say, I take the brand name version of that drug, as they would say a brand name medication and then say, I take the generic version of that. The same way that, we may not know, alprazolam, but I would render a guess that everybody has heard of Xanax before, or something similar like that. If you know that this medication has a brand name, you're probably going to hear the brand name and ask, do you take the generic version of that? You're not going to be as likely to get the generic version of a drug and then have to ask, do you take the brand name version of any of these medications? If you feel like that it's a drug that you know very well, like for example, I know because I've done this for a long time that alprazolam is the generic version of Xanax. You could ask, do you actually take Xanax or do you take alprazolam? But typically somebody's going to be reading off of their bottle of medications. They're going to be giving you the actual name of that medication. So I did just want to point that out as a function of this plan finder tool, just because we did not encounter that normally through our demonstration. But like I said, once we've entered in all of our medications, we're going to hit done adding drugs, and it's going to take us to our pharmacies. It's going to allow us to add up to 5 pharmacies that we want throughout here. It does give you the ability to enter in a street address or a zip code and the pharmacy name. But Gabe, what is their primary or preferred pharmacy?
CVS.
All right. Now this is going to sort of be adjusted by, distance based off the zip code that I provided. Now, because neither Gabe nor myself are from the New York area, which I believe is where we're looking right now, and yeah, we are. I'm not familiar with all the different pharmacies in that area or addresses or anything like that. So what I'm going to do is I'm going to just assume that this person is going to the pharmacy that is within this area, and is located the closest by distance here. So if I'm looking for CVS, boom, number 5 right here on the first page, I can find CVS. I'm going to get that added right there. You can confirm by address with them, hey, this is the one I want. If they have the pharmacy number as well, you can also check by that to make sure you've got the correct pharmacy. Gabe, does this person have a secondary pharmacy?
Walgreens is listed.
Walgreens. Okay. So I'll scroll back up just to make sure I did not miss Walgreens earlier, and keep scrolling down. I do not find it on the first page, so I'll tab right over to the second page and keep looking. And boom, I found Walgreens right here. So I'm just going to select this Walgreens specialty pharmacy and put that on there. One of the things that you will notice too on the top of each one of these tabs as well is mail order pharmacy. So let me locate back to the first one just so I can show y'all that that is in fact correct. See mail order pharmacy right there as well. Gabe, does this person have any interest in mail order pharmacy?
He is. He says interested in mail order if the drugs are cheaper.
Okay, great. And that's always a good question to ask, is if somebody has some interest in mail order pharmacy. In general, there are pros and cons to, get the way that you receive that. Mail order, of course, comes through the mail. So you are subject to the whims of how quickly that mail can be delivered. If you live in an area where maybe you get some extreme weather, extreme snow and ice or hurricanes or something like that, that may cause an interruption to regular mail delivery, you do run the risk of perhaps your prescriptions not being delivered at the time that you expected. Also, because it is mail too, you are, of course, able to have things, taken from your porch or packages stolen or lost or anything like that. Mail order also does come on a 90-day supply as well. So these are things that, factor into somebody's decision, but this person is interested in mail order, probably understands all of these things. I always like to run through it with everybody just to make sure they understand, but they are interested in looking at this option if the drugs are cheaper. So we're going to, of course, honor that and include that in the comparison here. And They do not have any other pharmacies that they want, correct, Gabe?
That is correct, yes.
All right. So once we've done that, we're going to go to done adding pharmacies and move forward to the actual information right here. Now, it's going to also ask us to add important healthcare providers. So does Mr. Jones have any preferred, excuse me, Mr. Doe, John Doe here, does he have any preferred healthcare provider or a preferred hospital, Gabe?
He has not listed that, no.
Okay. Let's just look right here. He does not have any preferred providers. Gabe said, nope, he does not. So what we're going to do is we're going to skip adding providers right here. And what it's going to give us, it's going to pull up the comparison page right here. You'll see right up on the top left, we discussed earlier that we're reviewing plans for the year 2026. Obviously, if we wanted to look at 2025 plans, we have a way to just select that right there, and it would switch this over to be current plans. But since we are looking for next year, we're going to keep it right here parked on 2026. We also do have the ability to include special needs plans for dually eligible people. This for people that have both Medicare and Medicaid. So obviously, if you do not have Medicaid, you would not be eligible for a special needs plan. This person does not have any form of financial assistance, no Medicaid, so they're not eligible for that. So we're not going to include those. And you can filter by, different health plan types. If you're looking for an HMO versus a PPO, the plan benefits, insurance carriers, type of drug coverage, star ratings, but we're not going to do any of that at this point. You'll look right over here at the right. It has how these plans are sorted, and it's going to give you a couple of different options. The lowest yearly drug deductible, the lowest health plan deductible, the lowest drug plus premium cost, and the lowest monthly premium. That's going to be automatically set to populate lowest drug plus premium cost. Essentially, this is going to be saying, based off of the prescriptions under this plan, these are going to be going from the least expensive overall for the year down to the most expensive, because it's going to include what your costs are for your premium and what your costs are for your copays, your out-of-pocket cost at the pharmacy. There's going to be some additional factors with a Medicare Advantage plan that we'll get into a little bit later on. But for right now, we're just solely comparing these based off of our prescriptions. So we're going to look right here. And Gabe, I do not believe that this gentleman has any preferred insurance company, correct?
No, he has not listed in.
Perfect. You'll notice right here, I asked that of Gabe because if somebody, for example, was interested in, say, a Blue Cross Blue Shield plan, then I would want to include one of those Blue Cross and Blue Shield plans, regardless of where they lay on the list of cost-effective plans, because they're interested in that. However, because they're not interested in any particular insurance company, we're going to look at what are the three plans that are going to be the most cost effective for them, essentially the top three plans on this comparison. Now, I just want to show everybody for the interest of all of this that you'll see that all of these, it's just listed, all of these plans one after the other. I'm going to navigate to just the final page to just show everybody the figure of the most expensive plan for next year would be $3,298.20, just to give everybody a idea for what the amount of savings this person could have, as opposed to what would be the highest costing or least cost effective plan for a Medicare Advantage plan that they could select. So We're going to go right back to the first page and right up top here, and select the first three plans. And I do want to just call attention. We'll focus in on some of these things a little bit further on as well. But you'll be able to glean just some very quick information from this page regarding, monthly premiums, total drug and premium costs for 2026. You'll see that the most expensive one was 3,900 and some odd dollars. This one says zero. Other cost, a health deductible does not have one. Drug deductible is $615. What's the maximum in network out of pocket cost you would have under this plan? Plan benefits, these are additional benefits that are outside of what Medicare covers, that may be of interest to people. Gabe, has this person identified that they're interested in any extra benefits?
He has actually. He has listed vision, dental, hearing, and a gym membership.
Okay. So you're able to see dental, vision, hearing, fitness benefit. This first plan ticks all the boxes. So that's just something really quick. If you're just kind of giving a cursory glance and somebody has really told you, right off the start, look, these are my priorities. Then when I'm doing a comparison, if they say, my plan has to include all of these, then I would obviously look. And if, one of these plans did not include what this person was looking for, then maybe I would say, well, okay, well, I'm not going to select that one. I'm going to move on down to the next most cost effective one. However, we're going to go ahead and just compare the top three that we selected and go from there. You'll see that is Health First 65 Plus plan. That's an HMO, a health maintenance organization. Elder Plan Flex, that's an HMO POS plan. And the AARP, Medicare Advantage from United Healthcare, PPO plan. Just a really quick, HMOs are generally going to be the more restrictive. They're going to, in general, have a more restrictive in-network only network, where PPOs are generally going to be a little bit more flexible. They're going to be more likely to have an in-network and out-of-network coverage within there. But that does not mean that is reserved primarily for one of those. That is just a very quick, in general, overview of HMO versus PPO. But we'll take a look right here, and you can see that past just that information, that they've got, places where you can go and select to view that plan's details a little bit further. They've got star ratings. You'll see that's 4.5 stars right here. That's 3.5 stars. This one's also 3.5 stars. The health deductible that exists right here. This one is nothing. This one has a $1,250 annual health deductible. Deductible is what you have to pay out of pocket before your plan will start paying. A drug plan deductible, $615, which is the maximum for next year under Health First, $375 under Elder Plan, $600 under AARP. What's the maximum that I would pay out of pocket for health services? $9,250 in network. Elder Plan Flex, that's $7,550 in and out of network. So if I go in network or if I go in and out of network, a combination, it would still be $7,550. You'll see under AARP, if I stay in network, my out-of-pocket coverage, my out-of-pocket maximum is going to be $8,900. If I go out of network, that raises up to $13,900. So these are just important things to sort of note. You are still responsible for paying your Part B premium. This is the figure for 2025. The number for 2026 has not yet been released. So these are still with existing 2025 Part B premiums as well. Again, the plan features that this person had identified as being very important to them: dental, vision, hearing, and fitness. All three of them include those. You'll be able to look at the benefits and cost under each one of those. We're going to come back to some of these benefits and costs a little bit later on as well. So I do want to just point out that, these are for specific health needs. Right here, it's going to give you, does this offer in-network or out-of-network coverage? And then what's the copay or co-insurance based off of that service and whether I'm in-network or out-of-network. It also includes information about our extra benefits. It'll give us in-network costs, if it's covered, if it's not covered, in-network, out-of-network. For all of that was for hearing, this for dental, comprehensive dental, more extra benefits that exist. But we're going to navigate down to drug coverage and costs. Now, happily, all 5 of our 5 prescription drugs are going to be covered under each one of these plans. And it looks like that our out of pocket for the year, with our premium and cost included, are 0, no matter where we go. So all 3 of these plans are on equal footing in terms of costs related to their prescriptions, which is great. I know that some people may tell you that, hey, I'm willing to pay a higher premium if it means that I'll save more money on my copays or costs. That is certainly something that we can facilitate and look at. Happily, all 3 of these, the top plans, have no premium and are costing nothing for drug plans. So that is something that would not be as big of a factor in terms of the prescriptions right there. So how would this person then therefore go and determine the value of this? Well, let's cover that by just doing a deep dive of some of these comparisons, and I'll show you how somebody could maybe take a next level of comparing these, especially given that these are Medicare Advantage and there are health benefits that are necessary within there. So just quickly, I just selected Health First 65 Plus plan merely because that plan was the first one that existed right here. It was the furthest to the left, and it had the highest star rating. That is something that, generally is sort of like the last level of how I would determine the value of these plans. Is you look at what's the coverage going to look like? Is it going to cover everything I need? Are all my doctors and hospitals in network? Then what is the cost going to look like? And then I would look at the star ratings to see, what has been, the experience of others, and how do I value, what the feedback on this plan is. And we'll show you some of that here shortly as well. But right now we're just going to continue focusing on the pharmacy aspect of that, and show you how you can read some of these plan details too. So in my Health First 65 Plus plan here, I can find information about the plan, how to get to their website, the number that I can call if I'm not a member, the number I can call if I still am a member, and then some information about my total monthly premium. Do I have a health deductible? No. What I would pay at my primary doctor is $0 copay. And then the estimated total drug cost, the lowest cost retail pharmacy under this plan. So I'll go through the overview here, and it's got the same information that I had sort of pointed out earlier on that comparison page of our total premiums, our total, what our Part B premium is going to look like. Again, that's still 2025. Health deductibles, drug deductibles, again, the maximum $615 for next year, the maximum out of pocket that I would pay, the benefits and costs for doctors and for hospital. I'm going to skip this just really quickly because we'll come back to that here shortly. And I want to skip down to drug coverage just so I can explain to everybody how I would read this comparison and read the benefits under this plan. When we get to drug coverage here, we can look at the medications. Again, you want to just double check that these are the information that you had received and that you got the quantity and frequency correct, because it could, have a huge effect on your comparison. It will give you whether the pharmacy is out of network, in network, and in network and preferred. Um, Out of network means you can't go there with this plan and get coverage for these prescriptions. In network means you can go to that pharmacy and get coverage. If it says in network and preferred, that means you could go to that pharmacy and you're going to get the best deal in general at one of those preferred pharmacies. However, all these pharmacies are in network. None of them are preferred pharmacies, but they are all in network, so you can get coverage. As we scroll down, the yearly drug cost by pharmacy, because all of these drugs are covered completely, none of them have a yearly total. You can see the total yearly drug cost that would exist right here. And then it's got a breakdown of the total premium plus drug cost at each one of these locations: Walgreens, CVS, mail order. Good news for this person: if they're interested in mail order, it is going to be just as cost effective as going in person to the pharmacy. So it's really up to their preference and what they want, how they want to receive their medications. And then you can find the breakdown month by month of what they would be paying in the pharmacy for these medications. Because there is no copay to these, they don't have any cost for those, and therefore would not incur any sort of cost either. I will point out too, this would be the point in which you would have the option to look up information about the Medicare prescription payment plan too, where you could click that and it would give you a comparison broken down of that Medicare prescription payment plan, which was new in 2025. That allowed people to break down the costs of their plan and even that out throughout the calendar year. But because there's a $0 cost with these prescriptions out of pocket, you're not going to see that existing right here. If you wanted to get more information about the retail cost, the cost before the deductible, after the deductible, once you reach the catastrophic coverage, it all exists right here under these collapsible pharmacy information. Again, because we're not going to meet our deductible, we have no out-of-pocket cost at these pharmacies. You're not going to get a ton of information off of these right now. But in any scenario where you did have copays during a comparison, that would be how you navigate that. You can also expand view more drug coverage to get some information about how much these would cost, given any particular different changes in phases, what tier they are, do they require prior authorization, do they have quantity limits. This person's not taking a high number of any of these particular medications, therefore they're not really going to have to worry about some of these prior authorizations or quantity limits or anything. But it's just good to know some information about, for example, if I needed to get more of my atorvastatin than a 30-day supply, that I would need to get doctor's approval and put that through my plan before I could necessarily get that those drugs as well. I also mentioned some information about star ratings and taking those into account. You can navigate right at the bottom for the star ratings. You've got the total star rating, and that's broken down between your health and drug plan star ratings too. So my health plan rating, has things like staying healthy, screenings, tests, and vaccine. The higher means the higher that consumer experience has been, managing long-term conditions, members' experience with the health plan, whether that being the ease of needing care and to seeing specialists, getting appointments quickly, that it's providing information or helps members when they need. That's dragging them down a little bit. Members' ratings of healthcare quality, members' ratings of their health plan, coordination of members' health services. The higher stars means there's better coordination. So most likely the plan is relying on the beneficiary to coordinate their own health services, as opposed to that plan sort of taking a large role in doing that. member complaints about the plan, customer service. Obviously, the higher stars means better customer service, and then drug plan, customer service, member complaints or changes in the drug plan's performance, member experience with that plan, ease of getting prescriptions, their rating, members choosing to leave the plan. More stars means fewer people leave that plan. Drug safety, that depends on what drugs a particular person is taking and their need for that. So you may not be taking any diabetes or blood pressure medication, so that may not be entirely applicable to you, but you can take a look at the star ratings in this section, and explain those to people so they can get an idea of what they would be looking at in terms of how members of these plans are rating these plans. But if both of those look good to them as well, then that's great. I mentioned earlier about how do we sort of, if my drug plan is $0, how do I really determine which plan is best for me and which one is not? And what we're going to have to do is we're going to have to look at the health plan benefits to try and determine that as well. So I'm going to ask Gabe a couple of questions about this person to try and gauge what I can about their health needs. So, Gabe, how regularly does this person go to see their primary care physician?
4 to 6 times per year.
Okay. And along with that person, are they seeing any specialists?
They have listed an endocrinologist and a rheumatologist 3 to 4 times per year.
Okay. So we'll just assume that, say, they're going to see a primary care physician and going to see a specialist about every quarter of the year. So what I would do is navigate either, on our comparison page that we started out on, or if you have sort of decided, hey, this is the plan that I'm really interested in, I'm going to look at this, when you could go to the plan details and look at that information. And we will go back and just review that information. But I'm going to keep it on this comparison page first, because we'll be able to look at all of these side by side, and get a determination. So this person says, I'm going to see my primary care physician 4 times a year. So under Health First, if I stayed in network, I'd have to stay in network. So only see doctors within this plan's network. If I go to see my primary care physician, I'm not paying anything out of pocket to see my primary care physician. If I go with AARP, if I go 4 times a year, I'm going to pay somewhere between nothing and $160 in copays for that doctor visit with my primary care physician. That's if I stay in network. If I go out of network, I'm going to pay 50% of whatever the cost of a primary care visit is, which can be, anywhere from, nothing to hundreds of dollars to see your primary care physician. So you want to be mindful that, hey, if I go out of network, I could, pay something. So in terms of the primary doctor visit, these 2 plans look like they're going to be the most cost effective thus far. We'll look at the specialist as well. They're going 4 times a year for that specialist too. So this one is $35 copay. That's $140 per year for their 4 specialist visits. This one under Elder Plan is 0 to 35, so somewhere between 0 and 140, depending on where you go. That's in and out of network, so you can go see a specialist out of network. Gives you a little bit more flexibility there too. Under AARP, it's 0 to 55. Out of network is a 50% coinsurance. So just based off of the primary care information and our specialist doctor, it does look like that this one's going to be the most costly. This one's going to be the second most costly, and this one's going to have the highest likelihood of being the most cost effective, just based off of these specialist visit and primary doctor visit, just because that one is between 0 and 35 on the specialist as well. Now, I don't know, Gabe, if this person has named that they're in the hospital any number of times per year. Do they include any of that information?
They do not, no.
All right, great. It in the case where somebody says, I've not been to the hospital in a while or anything like that, what you can do is you can sort of do a projection. Here's my worst case scenario, just to give you like your things to think about is if I went and needed, some emergency care, I'm paying a $115 copay at an emergency room. If I go to urgent care, $40 copay, $35 copay, $0 to $40 copay. So this one still, out of everything that we've looked at, is still coming up the most cost effective. But we'll get to the inpatient hospital coverage because these vary some. What you'll typically see is you'll see an amount of money per day for a number of days. The amount of money per day may change. The number of days that they allow may change as well. But let's just take a look at these. You'll see $489 per day for days 1 through 5, 0 for days 6 through 90, $0 per stay. That's in network. For this one, in network, $425 per day for days 1 through 5, 0 for days 6 through 90, 0 per stay. Out of network, it doesn't have any information. I would assume that means that they're not paying out of network, but we'll find out when we go and look at some plan details a little bit later. In network, $325 per day for days 1 through 3, 0 per day for days 4 through 90, 0 per stay. If you go out of network on this one, you're paying 50% per stay. So how I would pose this to John Doe is I would say if you got into an accident and had to be in the hospital for a week, then under Health First, you would be paying, about $2,500. Let's do that exactly. $2,445 per week, per that week that you were in the hospital. Under this one, if I went into an in-network hospital, I'd be paying, about $2,000 to be in that hospital for a week. At that, if I was there for a week, I believe that's $2,125 specifically. And then under this one, I'd be paying $975 for that time in the hospital. Of course, if I went out of network, I'd pay 50% of whatever the cost is. So that does let us know that, hey, okay, maybe the out of network coverage, or excuse me, maybe this elder plan is going to be, the most cost effective from a health perspective. You can really go in and look at the plan details around its benefits at the doctor and hospital section to really get some more information. You'll see some information like limits apply on some of these, and it's really important that you look at what limits are being applied to certain services, especially ones that are big priorities for you, because you want to know, hey, what sort of, for lack of a better term, hoops am I going to need to jump through in order to be able to satisfy that this service is good for being covered at that point in the year. The same thing is you're going to need advanced plan approval required in order to get in order to get advance approval for that payment to be paid for a specific service or item furnished to an enrollee. So you just want to pay attention to some of these and help everybody to sort of do a calculation based off of whatever their needs are to say which one is going to be the most cost effective. So, for example, now that we've looked at these and I've compared what their needs are versus this, I would be able to tell them based off of what you've told me, I would say that the Elder Plan Flex is going to be the most cost-effective option for you out of the comparison that we've done right now. You'd have nothing out of pocket to pay for your prescriptions. And then if you went to your doctor, your doctors and your specialist, you pay somewhere between $0 and $140 per year based off of what the copays are in network and out of network under this elder plan and how many times that you go see those. And then if you went into a hospital setting for a week or longer, you'd pay $2,100 each time that you went into the hospital, all the way until you reached a $7,550 point, in which case you would have met your out-of-pocket maximum and you would pay nothing for the remainder of the year. And that's how you could do that comparison and read some of these benefits. Before I wrap up and sort of ask about any questions that I may have sort of skipped over, I do just want to touch on some of these additional benefits too. You'll notice that's right below all the drug coverage that we skipped over a little bit earlier. This is especially where I would look at the limit supply. This is one of the things that appears a lot on these Medicare Advantage is it says plan limits. There may be limits on how much the plan will provide. If you have one of these benefits that you are really, really, really prioritizing, call the plan directly and ask them specifically about these limits, because the vast majority of people do not find these benefits comprehensive and do not meet their needs for what they are envisioning when they think of hearing coverage, preventive dental, comprehensive dental, vision. You'll see that endodontics, which is your caps and your getting your teeth drilled into a root canal. That's what I was looking for. There may be limits on how much the plan will provide. You really need to check and see, is that one per year? Is that a partial that they'd only pay for? They won't pay for a full one. It's good to ask questions about what you prioritize on some of these additional benefits, because they may not be quite as comprehensive as what you're expecting. Now, that kind of takes us to the end of the Medicare Advantage comparison. Gabe, I'll throw it back to you to sort of see if there's any questions that sort of still exist.
Sure. I just had a few quick questions for you. The first one is, I noticed John Doe had listed his ideal MA plan. Now, if I'm a first time, this is my first time trying to navigate the world of Medicare Advantage plans. Is that a good strategy for a first time person to just write down what their ideal MA plan is? Or what would your suggestions be?
I think, Gabe, I would just ask what were the particulars of their ideal MA plan?
In Mr. John Doe's case?
Yes.
He wrote down covers his prescriptions, doctors, and includes at least one extra benefit like dental or vision.
Okay, so we'll tick those things off. It covers his prescriptions. All of them cover his prescriptions. Includes doctors in network. What he would want to do is call his doctor and ask, do you accept Elder Plan Flex? Let's just say, for example, and if the doctor says, yes, I accept that, great. Or he could, of course, go through the company and say, is this doctor within your network? Same thing for any specialist, any primary care physicians, hospitals. I would call and ask if all of the people that I go see are within that network, because the other options are, I'm going to potentially pay out of pocket the full cost, or I'm going to have to go see somebody else that is in network in order to get that paid for. So he prioritized his doctors being in network. He would need to just take this before enrolling and call his doctor and say, do you accept Elder Plan Flex? Or call that non-member number and say, is my doctor within your network, to Elder Plan specifically? And that it includes one of those prioritized benefits. It includes all of those. So I would say, if he was going to call Elder Plan and ask, is my doctor within network? I'd call, and while I'm doing that, also ask for specifics on some of these extra benefits. What are the limits on, let's just say, for example, his vision is what is his concern. It says there's plan limits on eyeglasses, for example. What are the limits on my eyeglasses? What are the limits on my routine eye exams, so he can understand those benefits a little better and make sure that he is getting the most out of his Advantage plan as what he wants. But I would say just a in general answer really quickly is that hit all three of these stand a very good chance of meeting what his ideal Medicare Advantage plan is, because they all cover his prescriptions. They all include at least one of those benefits that he is interested in, and he would have to call to make sure that his doctors were in network, but he would have that ability to, of course, check and do so, and would fulfill that need. So I think he has come to the table a lot more prepared and understanding of what he's looking for than what the general public would come into this situation looking for.
And what are some of your pros and cons in navigating Medicare Plan Finder, especially for Medicare Advantage plans?
Sure. I think that one of the big pros of this is I think that it's really great that they make all of this information available. Being able to look at how much is it going to cost at the doctor, at the hospital. It can trip people up that the Medicare Advantage plans have that difference of not only price, but the days as well. So, making sure to pinpoint on, yeah, this one is that much for 5 days, this one is that much for 3 days. That's something that can trip people up. You'll notice that, when we were looking at these benefits on the comparison, those extra benefits, it didn't say anything about, plan limits or limits may apply for any of these on the comparisons. You have to go into the plan details to get this information about, hey, limits may apply. So that's something to be very, very careful about, and is definitely on my cons list. Is, I think that sometimes people can look over those things and therefore sign up for something expecting to get more than what they are receiving. But I will say, just the ability on Plan Finder now to be able to filter by, do I want solely PPOs where I can have more flexibility on going in and out of network, being able to, prioritize, yes, I'm looking for all of these benefits and I don't want to see anything that does not include vision coverage, dental coverage, that sort of thing. Really strong on the Plan Finder, and has not always existed. So I would say that those are really my pros and cons of Plan Finder, and sort of the pain points of what I do to sort of insist to people about, hey, this is what we need to look at while we're doing your comparison in order to make sure that you find a plan that suits you the best. And I typically, whenever I was counseling people, would not immediately sign somebody up for a Medicare Advantage plan. I would ask them to call their doctors and pharmacies, check and make sure all of their people were in network, and then give me a call back if we were going to move forward and do an enrollment. Speaking of that, you can, of course, at any point go and hit enroll. You'll fill out people's information. That'll include your Medicare claim number, your date of birth, address, all sorts of stuff. It will ask you, do you prefer large print materials? Do you prefer electronic communications only? It's available for people to be able to do that. However, you do not have to, nobody has to make a decision on the spot. You can print all this information out, provide it to somebody to look over, where they can take some time to think about that and then get back to you, or of course go on Medicare.gov themselves and enroll themselves. Printing Medicare Advantage can be pretty time consuming, because there's so much more than what exists on a PDP plan. If I printed a comparison and the plan details for each one of these plans, really I'm looking at somewhere around maybe 10 to 20 pages. On this Medicare Advantage, it could get up to above 30 or 40 pages to print all of this out. So just be mindful if you're printing something like this out, that you may want to make sure that your printer is up on its ink and that you got plenty of paper in there and that you've got a little bit of time to put all that together.
Wonderful. Well, I don't have any more questions. This has been fantastic. A lot of wonderful advice. Any last words before we close?
No, it's a great time. Everybody should go and do a comparison where they have the opportunity to for the annual enrollment period and be well prepped for 2026. If you enroll into a plan, it takes about 3 weeks from when you enroll to when you receive all of your materials from that plan. So if you enroll, at the end of the annual enrollment period, you may not have all of your materials by the time that we reach the end of December. That does not mean that you do not have coverage. You will still be covered as of January the 1st when that coverage begins. But of course, it's always good to make that decision, get enrolled a little bit early to make sure that you have all your materials with you and together as we roll into 2026.
All right. Well, thank you for joining us. This concludes our presentation.